Actually, we had a question. I think you explained it very well around, the difference between progression-free survival and overall survival, and kind of how we understand these various clinical trials, which I think you already covered. But with all these, as a patient, what should the patient care most about when it comes to these three choices? Or kind of, would you encourage them to start the conversation with their provider around the various choices? Just trying to kind of, understand what that means today for a patient.
Yeah, I mean, that's a great conversation to have with a provider. And we in the breast cancer community spend a lot of time talking about these topics amongst ourselves. I think we all agree that the most important thing is live as long as you can, survival. And so that's always been the North Star that's guiding all of the research. But looking at that as an endpoint from a research point of view is a little harder because it takes a long time to have that data mature, and it involves not just the initial treatment. So let's say someone's getting abemaciclib and they're on it for quite some time, and then if cancer gets worse, they have to switch to something else. There may be many, many switches that happen between that initial time of switching and the overall survival. And so it's measuring not just that initial step, but it's measuring many other steps beyond, what we call post-progression. And so it becomes a little complicated to interpret the data, and particularly differences between progression-free and overall survival. But I think that, I think essentially survival is what matters most, and that should be what is guiding our clinical decision-making and also guiding how we approve drugs to be used for breast cancer.
Okay, great. Thank you.